Hi guys, I'm Dr. Preeti Sharma. I'm an educator on the platform of Unacademy and I am here with the series and continuing the IOTD image of the day at 10 p.m. I hope all of you are also following the morning sessions as well as the evening sessions which are being carried out on the Unacademy app, which are free special classes. From my side, we have a prime time 9 p.m. special class which is now planned in these days, which help you rapidly revise your course for the upcoming NEET PG exam. So what do we have in today's session for the gross and the microscopy? So first we have this thyroid gland, which I've kind of described also for you, so you just need to tell me the disease. So you see this thyroid gland, which is definitely enlarged diffusely. As you can appreciate, the entire thyroid gland is enlarged, and what you see very characteristically is the color. It is a beefy red diffuse enlargement. So let me take some sections out of it. Let me see what is the finding that I'm seeing. So what is the finding if I remove the labelings and ask you, tell me the findings. So you will obviously say that, the disease, whatever you're thinking of in terms of this beefy redness, is something to do with hyperplasia. Why do I call it hyperplasia? Because I expect the thyroid follicles to be nice and round like this. But over here, my thyroid follicles are becoming like this and showing me these little projections also, called, pseudopapillary projections. Little micropapillary projections are seen. Apart from that, do you also notice at the periphery, it looks as if the colloid is being eaten, it is being scooped out. So this pink color material is the colloid, and at the peripheries, it feels someone is trying to scoop it out like an ice cream scoop. So that finding is known as scalloping of colloid. Can you see? At the peripheries, it feels as if someone's trying to eat up that colloid. That is indicative of hyperplastic activity. So repeating for all of you, this is a case of Graves' disease. What all do you see? So Graves' disease shows you diffuse beefy red enlargement of the thyroid gland. It shows you hyperplasia of the follicles. It shows you scalloping of colloid. Now, a very expected question for the exam is that what would you see in the FNSE of Graves' disease? FNSE of Graves' disease shows us a finding known as fire flares. It looks as if the cells are on fire. I hope day before yesterday you remember the 2 days back actually I taught you the adequacy criteria of this FNSE of thyroid. I hope you remember. So you are supposed to know that. But apart from that, you're also supposed to know that in Graves' disease specifically, these cells, it shows as if there is some kind of fire on top of them, as if they've caught fire. That is basically known as fire flares. And what are they? They are dilated ERs. They are dilated endoplasmic reticulum. So repeating, fire flares are seen on FNSE, hyperplasia and scalloping of colloid on biopsy, and diffuse enlargement, beefy red on the biopsy specimen. That is a case of Graves' disease for you. Thank you for joining in. Tomorrow, yet another session, same time, same channel, 10 p.m. Thanks a lot. Good night.